Live. My name is Gurjeet Kalkat. I'm the Chief Medical Officer at Emanate Health in Covina. Emanate Health has many platforms to engage the community surrounding us in 3 hospitals, to engage our communities, tell them what's going on at Emanate Health, make them well prepared for what's coming on in their life journey. Today, we have Dr. Youssefian, a family medicine doctor who's been with us for approximately 5 years, and he's going to talk about prevention and screening in adults. As they say, an ounce of prevention is worth a pound of cure, and we all probably had some kind of resolution at the beginning of the year for our health. Dr. Youssefian is going to talk about the guidelines on prevention. So without further ado, Dr. Youssefian.
I'm very happy to be here. Thank you so much for having me for this talk. So being trained in family medicine, one of the pillars of family medicine is prevention, okay? So we oftentimes think that preventing illness is more beneficial than treating illness. Okay, so today I'm going to be talking about some of the updates for adult preventative screening recommendations. So some of the things to know about these recommendations are that they do change, okay? So today is January 24th, 2023. If you're looking at this video at a later date, some of these recommendations might have slight adjustments, okay? These recommendations are always under review, always being looked at, and some of these recommendations might be different, okay? So I just want you to keep that in mind. For the objectives for today's visit, I want everyone here to realize what a screening test is, okay? So what is a screening test? Why do we perform them? What are some of the benefits? And are there any harms? So is there any risks? Could these potentially be harmful, okay? And then after we discuss what a screening test is and we have a better understanding of what screening tests are, I want to go over some specific recommendations specifically for cancer screening, endocrine screening, which is more hormonal, cardiovascular screening, which is for heart disease and other things, and then some other screening recommendations that are available for us, okay? So first thing, what is a screening test? Okay, so a screening test is basically a test that is checking an asymptomatic patient for a disease. So asymptomatic meaning that the patient isn't exhibiting any symptoms, okay? These aren't intended to diagnose disease. These are only intended to basically determine if there is a problem, okay? Oftentimes, these tests do lead to further testing. So, for example, if you had a screening mammogram and there was an abnormality seen on the screening mammogram, your doctor may order other diagnostic tests, such as a diagnostic mammogram or other imaging modalities, okay? So there's a difference between a screening test and a diagnostic test. So why do we screen? Okay, so this is an important question, and people ask me this all the time, doctor, why do we do our colonoscopy? Why do we do our mammograms? What exactly are we doing this for? And there's a lot of benefits that come from screening. So one of the main benefits is that we're detecting potential diseases in people who do not have symptoms. Unfortunately, oftentimes, especially with advanced illnesses like advanced cancers, people might not exhibit symptoms until the disease is advanced, okay? So this is a way of us kind of getting ahead of the ball because, getting an early detection, because early detection can lead to early intervention. And that can make a huge difference in people's lives, okay? Sometimes intervention can be as simple as making lifestyle changes, so decreasing your sugar intake for diabetes, getting more exercise, reducing your salt intake for blood pressure problems, things of that sort. Sometimes it can be a little bit more involved, like medications, and sometimes we would recommend surgery, okay? Oftentimes, these early interventions can mean more effective treatments and better outcomes, okay? So, again, we just want to stay ahead of the ball, get things taken care of before they become a much, much major problem in the future, all right? Unfortunately, there are some harms with screening as well. Okay, so the biggest harm is false positives. So what a false positive is when a person tests positive for a test, but doesn't have the disease. Okay, we saw this unfortunately very commonly recently with the rapid COVID tests. Just because the rapid COVID test came out positive doesn't necessarily mean that you have the disease. That's just one example, okay? So because of these false positives, it may lead to overdiagnosis and possibly even overtreatment. Okay, so it may lead to further testing, may lead to biopsies, may lead to things that other tests and other blood tests that may potentially cause harm. This also can increase health public spending. So not only just for the individual, but for health systems. Further testing often requires resources, and those resources may take away other resources from others and the community. Unfortunately, as well, some of these tests may not necessarily change outcome. Okay, so again, if the disease is very advanced, they may not necessarily change the outcome for the patient. And these risks or harms are varied based on the test and the disease, okay? So, for example, screening for blood pressure involves putting a blood pressure cuff on your arm and checking it, not much harm there, okay? Whereas doing a biopsy of your prostate can often lead to other potential problems and can lead to potential harm. Okay, for this presentation, I'm going to be mostly discussing the recommendations from the United States Preventative Services Task Force. I know that's a handful. We usually recommend it, we usually regard it as the USPSTF, okay? And this is a government agency consisting of 16 volunteers who have been nationally recognized as experts in prevention and evidence-based medicine. And these 16 volunteers come from all kinds of specialists, including family medicine, internal medicine, OBGYN, geriatrics, and nursing. Okay, so we have a very, very wide range of expertise. These recommendations are usually based on age and gender, based on the principle of long-term and future benefit, okay, for the patient and for the community. Okay, we want to reduce harm to individuals, so we don't want to order tests unless they're necessary because what I said before, where there is potential harm with overtreatment and overdiagnosis. And of course, these recommendations only apply to certain individuals. So I'll go through some of these recommendations kind of one by one and discuss with you what these recommendations are for what individuals. Okay. And just as a side note too, there are other professional societies out there, such as the gynecologists and the American Cancer Society, which have slight variations to these recommendations, but for the most part, the USPSTF recommendations are the gold standard. Okay. So firstly, I want to talk about cancer screening, okay? So this is probably one of the biggest topics when it comes to the USPSTF recommendations, something that every physician should be thinking about every time you come into the office, okay? Everyone's favorite topic, colon cancer screening. I'll start off with that first. So it's recommended for all individuals ages 45 to 75, okay? And this is a change. I'm not sure if a lot of people are aware, but recently the recommendations were dropped from age 50 to 45. So now we recommend screening from 45 to 75, okay? And this is done with multiple modalities. So there is a stool-based test, and there's also direct visualization, all right? So stool-based test is where we would require a stool sample. Okay, so for the first test here, the fecal blood test, also called the FOBT, or the fecal immunochemical test, often called the FIT test. These are repeated every year, and what these involve is obtaining a stool sample and using chemicals to detect if there's any blood in your sample. And blood, unfortunately, can be a sign, may be a sign of colon cancer. Okay, so this often requires further testing. There's another test called the FIT DNA test, commonly known as the Cologuard, and this is repeated every 3 years. This is a slight variation on the FOBT and the FIT test because this actually detects altered DNA, which could be a sign of colon cancer. Okay. The next ways we test for colon cancer are the direct visualization. So this is where we can directly look at the inside of the colon to detect if there's any kind of abnormalities or polyps. Okay. Flexible sigmoidoscopy is basically it's a thin short tube that we use to look into the rectum and into the bottom third portion of the colon, so just the very end of the colon. And we repeat that every 5 years, okay? If you do combine that with one of the stool-based testing that we talked about before, the FIT test, the FLBT test, that can be done every 10 years instead. Okay, so that's what's one option. Second option for direct visualization would be the CT colonography, which is often called the virtual colonoscopy, and that's repeated every 5 years. This is slightly different. So this involves taking a series of x-rays of the entire colon, and then a physician would take a look at the images on his or her computer and give his or her recommendations from there. The gold standard is a colonoscopy. So colonoscopy is similar to the flexible sigmoidoscopy, but this is a slightly longer tube, and we are able to take a look at the entire colon and the rectum with this test. And one of the advantages for this test is that we can also take biopsies and samples and remove polyps during the procedure. Okay. With the colonoscopy as well, so unfortunately, when these other above tests are abnormal, you oftentimes require a colonoscopy as kind of like a diagnostic test anyways. So the colonoscopy is kind of like our gold standard, okay? But these other options are available, so if you don't feel comfortable getting the colonoscopy for whatever reason, talk to your doctor about these other options, okay? And then you guys can determine which options are best for you, okay? Next, moving on to breast cancer screening. All right, so breast cancer screening is recommended for ages 40 to 74-year-old women. And for 40 to 49 years of age, we do consider a mammography every 2 years, but this is an individualized recommendation, okay? So like I said before, so screening tests have some unfortunate risk, okay? It may lead to unnecessary biopsies, may lead to unnecessary imaging. So we typically start screening at age 50 to 74. However, if you are high risk, or if you had family history, again, it's kind of individualized, you may ask your doctor to start screening before, okay? But that's a conversation that you should have with your doctor, just so that you're aware of the risks and the benefits. There are certain conditions and certain gene mutations that can lead to further or earlier testing than recommended. Okay, most commonly we refer to them as the BRCA gene-related cancers, and in those kind of cases we may recommend screening at an earlier age. Next, I'm going to talk about cervical cancer screening. So cervical cancer screening is recommended for women ages 21 to 65, okay? And for 21 to 29 years old age, we recommend a pap smear only. And a pap smear is basically where we take a sample of cells of the cervix, okay? And that's directly through either a brush or a swab. And then for the 30 to 65 years of age group, we recommend either a pap smear every 3 years, just like the 21 to 29-year-old group, or we recommend a high-risk HPV test alone or with co-testing. And co-testing is where we would do the pap smear plus the high-risk HPV test at the same time. And that's repeated every 5 years, okay? Next is the lung cancer screening, okay? So lung cancer screening is recommended for ages 50 to 80-year-old individuals with certain criteria, alrighty? So this isn't a recommendation that we recommend for everybody. You must have a 20-pack year history and currently smoke or have smoked in the past 15 years, okay? And what a 20-pack year history means is that you've been smoking 1 pack per day for the past 20 years, okay? And there is other ways of interpreting this too. So for example, if you smoked half a pack a day for 40 years, that still qualifies as a 20-pack year history. So if you're not sure if you qualify, again, speak to your primary care doctor, and they can determine if you qualify for the lung cancer screening, okay? And the way we do the lung cancer screening is we recommend a low-dose CAT scan or CT scan of your chest every 1 year, okay? And After 15 years from your quit date, if there is no abnormalities detected, then we can stop screening, okay? So we can stop screening after 15 years from your quit date. So what this means is that if you quit smoking 20 years ago, then you no longer qualify for lung cancer screening. Okay, so again, if you're not sure, if you have questions, just make sure you reach out to your primary care doctor and they'll be able to navigate some of these complexities. Prostate cancer screening. So this is something that comes up almost every day in my practice. So the previous recommendations, these recommendations have changed quite a bit from age 50 to 45 to 55, and now it's almost more of an individualized approach. So the recommendation right now is individualized for ages 55 to 69 years of age men, okay? And the reason for this is that we found that prostate cancer screening may provide a small benefit, a small potential benefit for reducing chance of death from prostate cancer in some men. However, again, there were a lot of false positives, which led to a lot of unnecessary biopsies, which can lead to problems like incontinence and, in some cases, erectile dysfunction. Okay? So for that reason, based on family history, based on your personal risks, this is more of an individualized recommendation. And prostate cancer screening is no longer recommended for age 70 and older men. Again, goes back into, are we creating more harm for the patient? Are we making more risk for the patient? And what are the benefits? And we've determined that in 70 and older men, the harms may outweigh the benefits. Okay, next is endocrine screening. So this is more hormonal. We'll talk about a little bit about diabetes, and we'll talk about a little bit about osteoporosis for these. So firstly, with diabetes. So diabetes screening is recommended for ages 35 to 70-year-old individuals. So this is for men and women whom are overweight or obese. Okay, and that's based on a strict definition of your BMI, which is usually calculated during your visit of your doctor. And the way we screen for this is 3 different ways. One is called the hemoglobin A1C, which is a blood test, and that's done every 3 years. Another way is the oral glucose tolerance test every 3 years, or the fasting glucose test every 3 years. Okay, and again, these are screening recommendations, so if these tests were abnormal, so for example, if your test came out to show that you're pre-diabetic or diabetic, you might have stricter, more frequent screening or recommendations for testing. Osteoporosis. So osteoporosis is a process of weakening bones, which unfortunately does increase the risk for fractures, okay? It is recommended for ages 65 and over for women. And the way we do this is by doing a central or peripheral, so, checking x-ray images of your bones, using a DEXA scan or a bone density, okay? And those terms are kind of used interchangeably. And what this test measures is basically measures your bone strength, okay? It tests how strong your bones are, how likely they are to have a fracture. We do sometimes test for women less than 65 years of age, and that's for specific cases, if they're high risk for fracture, which includes some medical conditions, such as some hormonal problems, or long-term steroid use, things of that sort. But again, this is more of an individualized approach, and this should be something that you discuss with your primary care doctor if you think you are at higher risk. There is no recommendation for screening for osteoporosis for men. There just isn't sufficient evidence to make a recommendation for this. There are some cases and some disease processes where screening is recommended, but again, this is more of an individualized approach, and there is no broad recommendation for screening all men. Cardiovascular screening. So now we're getting more into the heart health problems. Hypertension. So hypertension is high blood pressure. Okay, that's another term for it. Screening for high blood pressure is recommended for ages 18 and over for all individuals. That's for men and women. For 18 to 39 years of age, it's recommended every 3 to 5 years. And for 40 and over, it's recommended every 1 year. And of course, for high risk individuals, every 1 year as well. And for this category, high-risk individuals include overweight, obesity, and having high normal blood pressures in the past. Hyperlipidemia, this is another term for high cholesterol. So this is recommended for ages 40 to 75-year-old individuals for both men and women. In normal risk patients, we usually recommend testing this every 5 years, at least every 5 years. We do test it more often in high-risk individuals, such as, again, overweight, obese, or people who have diabetes, things of that sort. And the recommendations for this are really based on equations and calculations that your provider can provide for you, given that you're above 40 years of age. Abdominal aortic aneurysm screening. So the aorta is one of the main blood vessels that comes off of your heart that feeds basically your entire body, okay? So it's the main blood vessel that comes off of your heart and feeds your muscles and your brain and your heart the oxygenated blood, okay? And the screening for this is recommended for ages 65 to 75-year-old men with a smoking history, okay? So if you are not a smoker, screening for a abdominal aortic aneurysm is not recommended. There are certain cases where this might be an exception, but again, this is more of an individualized. Broadly, we recommend screening only if you have a smoking history. And the way we screen for that is we do an abdominal ultrasound at least once, and then further recommendations are based on whether or not that test was positive, or what your risk factors are. So if you have certain risk factors, again, we may screen you more often. Okay. Okay, there are a ton of other screening tests out there, including for infectious disease. So, for example, we do screen for hepatitis C, we do screen for gonorrhea and chlamydia in certain cases, we do screen for tuberculosis and for HIV, okay? For psychiatric and social issues as well, we do screen for depression, anxiety, substance use, and intimate partner violence. For memory dementia, there isn't a broad recommendation for this, but again, there are some screening tests available for individuals. Pregnancy-related illnesses, so there is a whole host of pregnancy-related illnesses that are screened for by your OBGYN or gynecologist. And I just put this slide up there because I want you to be aware of other recommendations that might be out there that I might not have covered today. There's a wide range of host of things out there. And of course, if you feel like any of these screening tests apply to you, make sure you speak with your primary care physician. So some take-home points, okay? So I know that there were a lot of information out at you, and it was kind of a rapid-fire setting, so I'm sure you have tons of questions, right? But the overall message I want you to take home is that these screening tests are available, okay? These screening tests encompass many different diseases from many different health systems and many different organs. And they're important, okay? Again, like Dr. Kalkat said, like I said, early detection can make a very, very big difference in your life, okay? So getting ahead of the game, getting ahead of the ball, and getting these things tested for may potentially save your life. But there are limitations, right? Like I said, there are false positives, unfortunately. Make sure you speak to your doctor about these tests. Available and the risks. Make sure you understand those risks before you have the test completed, okay? Again, these screening tests are not intended to diagnose these because, again, these are to screen people who don't have symptoms to determine if the disease is present in the first place, but they often recommend a diagnostic test afterwards. So don't be surprised if you get a screening test done and your doctor recommends further testing afterwards, okay? If you have specific questions, if you feel like you are unsure if you qualify for these tests, or if you feel like you're not sure if you had these tests done or when you had them done, again, please make sure to reach out to your primary care doctor so you can arrange to get these tests completed. Okay, it's very important, especially in the beginning of the year, get these things done in the right time. Okay. I'm currently in the internal medicine office at the 3rd Avenue Suite on the Intercommunity Campus, located here in Covina. My phone number and my email are here on the slides if you'd like to reach out to me if you have any questions or concerns. Thank you.
Thank you, Dr. Youssefian. You did generate a lot of questions.
Okay, great.
Before I present the questions, he is accepting new patients. That was actually one of the questions. First question will go is for diabetes. Do I need to screen for diabetes with all three tests, or how does it go?
Those three tests. So I'll go back to my slide quickly. So we recommend either a hemoglobin A1C or a oral glucose tolerance test or a fasting glucose test. And then based on the results of this test, your doctor may recommend further testing.
Yeah. I mean, if I may add, most of the time it's just two blood tests, just checking your blood sugar and your A1C usually suffices. In borderline cases, especially during pregnancy, the oral glucose tolerance test is necessary.
Absolutely.
Second question is, this is more of a question, why don't men need screening like women do for osteoporosis?
Yeah, so a lot of research has gone into this. It's more of a hormonal difference. And women, unfortunately, because of menopause, are at higher risk for fractures of their bones. So even though most women, average age of menopause is at 48, we have determined that screening for osteoporosis, based on the risks and the benefits, 65 seem to make the most sense.
Okay.
So there are some conditions in which men can be tested for their risk fracture, their fracture risk. However, there isn't a broad recommendation for men.
All right. Thanks. A follow-up question related to osteoporosis. What is the next step after a bone density screening?
Test results. Okay, so depending on what your scores are, and your doctor should talk to you about your individual scores, talk to you about some of the potential risks, but it's generally categorized in three different categories. So either normal osteopenia or osteoporosis, and depending on those results, your doctor can give you more specific recommendations.
Yeah, basically another test in 2 years if your test is borderline abnormal.
Yeah, generally we recommend tests, yeah.
Next, this is an interesting one. Can I request a screening test even if I don't qualify based on the guidelines?
This is a conversation that you should have with your provider. So a lot of these recommendations are for the population, and depending on your personal health history or your personal risk factors, some of these tests can be done earlier. But again, this is an individual test, individualized, and requires a conversation with your provider.
Yeah. And get it done, but there are some limitations, especially your insurance may not pay for a certain test if you're not in that age category or sex category.
Absolutely.
So that can be a limiting factor, but definitely your primary care physician will accommodate your concerns.
Absolutely.
Next is, what is the prostate cancer screening test like? They want to know how we screen for prostate cancer.
Previously, we recommended a little bit more of an invasive way of testing it, using the digital rectal exam, which is where we used our finger to palpate the prostate. Some providers and some societies still recommend doing that. Another way is something called a PSA, which stands for prostate-specific antigen, which is a blood test. Okay, so most of the ways we screen for it now is through the blood test, through the PSA testing.
Yeah, absolutely. Another one is, I am 74-year-old woman. Do I need to get a mammogram after I turn 75? I think we may have answered this question.
If you're at normal risk, then we don't recommend testing. Again, but this is individualized, so if there's a lot of different factors that go into this, it's multifactorial, so based on your personal history, your family history, your other medical conditions, your doctor may recommend testing after the age of 74, but as a population base, we don't recommend it any longer.
Okay, good. The physician look for to determine if I need a prostate screening test. So that is basically the age group, and with some exceptions. I think you answered that, right?
Yeah, so it's based on age, but if you are having symptoms of prostate cancer, then again, we wouldn't necessarily do screening tests, we would do more diagnostic tests. So the typical symptoms of prostate cancer include problems with urination, so trouble starting your urine stream, feeling like you can't empty out your bladder, feeling like you're having to push to get the urine out, blood in the urine. So if you're having urinary symptoms, please make sure you talk to your primary care doctor. But at that point, we wouldn't necessarily do screening. We would look more for diagnostic testing.
Another one is, could you elaborate about the osteoporosis test? How is it done?
Yeah, so osteoporosis is a series of x-rays. It's a very specific way of doing x-rays. Basically looking at multiple portions of your bones. So central looks more at your long bones and your hips, whereas peripheral looks more at your ankles and your forearms. Basically looking at imaging to determine what the density of your bones look like.
All right. Is there a screening test for Alzheimer's/dementia?
So there isn't necessarily a screening test. There are some questionnaires that some societies recommend, but in terms of a broad population-based screening test based on age or sex, no, there is no broad recommendation.
Okay. One is, I'm very nervous about my mammography screening. How can I prepare for this?
Talk to your doctor. So, if this is something that you're having anxiety about, whether it be, family history or a friend that's, gone through an unfortunate event, and make sure you talk to your doctor about your anxiety related to this test. There can be accommodations that are done to get you to have the test completed. Sometimes your doctor may even recommend a medication or something to calm your nerves down so that you can have the test completed. So that's something that you should definitely bring up to your doctor so that they can at least help alleviate some of your anxiety.
Definitely, they can help you, answer all the questions and give you a medicine for your anxiety, because it is very important that you get the test.
Absolutely.
I'm a woman in my 20s. Any screening tests that are high priority?
Well, yes, there's quite a few actually. So for women in their 20s, so the cervical cancer screening would be one big one. So again, we recommend a cervical pap smear. I've done every 3 years between the ages of 21 and 29. And I didn't really touch on this, but there is also testing for gonorrhea and chlamydia that should be done yearly for all women in their 20s.
Very good. Questions about any supplements which prevent cancer?
Question. So there's a lot of research being done on supplements currently. Vitamin D is probably the biggest one. It probably has gotten the most press and the most news in the news most lately. Vitamin D has a lot of benefits, and there are some studies that were saying that it may potentially help improve the course of cancer, but obviously more studies needs to be done there. And as far as I know, there are no other vitamins that are currently recommended for prevention of cancer.
It's a very loaded question. There was actually a study done with some other vitamins to prevent cancer, but the actually study came out the other way. There was increased incidence of cancer, especially with beta-carotene and vitamin E. So more to follow as medicine evolves.
Absolutely.
Next one is on the BRCA gene. Do you recommend screening for other cancers if I have the BRCA gene?
The BRCA gene, there are some associations with other cancers. So if you are positive for the BRCA gene, I definitely recommend bringing that up with your primary doctor so you can develop a plan to determine what screening tests you should have.
All right. I think this is from the same person who's in her 20s. Are gonorrhea and chlamydia screenings for women invasive?
They can be done at the same time as your pap smear, so they're pretty much as invasive as a pap smear is. They usually require a swab done of the cervix. If you don't want to have the pap smear, if you don't want it done at the same time as your pap smear, you can always request for a urine test. Slightly less specific, but can also be done through a urine test.
This one, I don't know the answer. I'm hoping Dr. Youssefian knows the answer.
Okay.
What do you think about Angelina Jolie's approach to the BRCA gene? I have not followed up on Angelina Jolie lately, but so maybe Steve has.
I don't know.
Yeah.
I don't know.
Yeah, I am just guessing. Aggressive approach. A lot of women who have the gene will have prophylactic surgery. They'll get some of the female organs removed prophylactically, and they get their breasts removed prophylactically. I think you may be referring to that, but that gets really detailed. I think you should address that with your primary care physician. Recently, Damar Hamlin from the Buffalo Bills had a scary cardiac event. Was that preventable with a screening?
You know, I actually watched that live, but I actually don't know what event he specifically had. Dr. Kalkat, are you aware?
Yeah, actually, I can assume. Interesting, actually, that most of the athletes, especially the professional athletes, do get screened for any cardiac disease these days. They get at least an EKG. What happened in Mr. Hamlin's case was that in our heart rhythm, at a particular point in our heart rhythm, if somebody gets a hit, the heart goes irregular and stops, and that's what we think has happened. So at the present time, we do not have all the details of his medical history. This could not have been prevented. It was just very unfortunate. But the best part was, of course, the response, that there were people on this field who responded within 3 minutes. And if somebody gets a proper CPR within 3 minutes of a cardiac arrest, the recovery is nearly totally 100%. And that's what happened with Mr. Hamlin. So no screening for that particular test. But you can pick up certain EKG abnormalities on a screening EKG for these individuals. There's something called Brugada syndrome, where these people are prone to develop irregular heartbeat and pass away. They can get a preventive defibrillator or a pacemaker to prevent that. So that's on. Then, what can I, as a woman, do to stay healthy? Would appreciate tips for women's health.
Broad question, but also a very important question. So, ways to stay healthy. So, making sure you're eating regular meals, make sure you eat a very well-balanced diet, including carbohydrates, fats, and proteins. Make sure you get at least 30 minutes of exercise 3 times a week. That's the bare minimum that we recommend. So 30 minutes of moderate exercise 3 times a week. Make sure you get your screening tests done. So some of the things that we discussed, based on your age, make sure you stay up to date with your health. And of course, exercising and eating regularly and getting good sleep are all very, very important.
Yeah. Some people say that, people believe in destiny, but some of the destiny is written in our genes. So it's important to follow your family history to see what is running in your family and screen for that particular disease, as Dr. Youssefian mentioned in his presentation, so that we take care of it if it is coming up in you, if it's running in your family. Related to that, there's a question: if my whole family has diabetes, can I escape this cycle?
So diabetes has a very, very strong familial correlation. So the likelihood of you developing diabetes is very high. That does not mean that you're going to get diabetes 100% though. So there are ways of kind of staying ahead of the game. So, maintaining a good, healthy diet for you specifically, maybe one low on carbohydrates, getting regular exercise, and getting your screening tests regularly to stay ahead of the game.
Another one is, are there any screening tests for pancreatic cancer?
Broad recommendation for screening for pancreatic cancer. There are some cases where you're recommending testing, but in terms of broad population, there is no specific recommendation for pancreatic cancer.
All right. Add a comment to the person who asked about diabetes. take care of yourself, exercise, keep your weight down. But diabetes now is very well managed with the advancement in drugs is amazing. Some of the newer drugs in the past 2-3 years, people can become totally normal. So don't be scared of getting diabetes, but because there is treatment for diabetes. Another question is, how often should I see my family medicine physician?
Yeah, so this really depends on your age. For the younger generations, like teenage and 20s, I think the recommendation is at least every 3 to 5 years. Me personally, I'm a big proponent of prevention, so I would say at least once a year personally.
Okay. Angelina Jolie did get her both breasts removed prophylactically. This is it's a discussion to be had between a patient who has the BRCA gene and the physician, and how comfortable that patient feels with the decision. So a lot of, actually, more and more women are going that route, especially if they have breast cancer in one breast and they have the BRCA gene, they will do a prophylactic mastectomy of the other breast. Are there any screening tests which I can do at home myself? I think Dr. Youssefian can allude to some of them.
The fecal blood tests would be able to be done at home if you provide the fecal samples and bring them back to the lab. Other than that,
I think that's the only one.
I think that's the only one.
Another follow-up question on BRCA gene. Should all women get tested for BRCA gene if there is no family history evident?
Recommendations for testing for BRCA gene.
Yeah.
It's based on your family history.
This is an evolving science on BRCA gene, not only amongst women and breast cancer, but it's associated with cancers of other female cancers. Even prostate cancer has an associated BRCA gene. So we will know more in the next few years. As Dr. Youssefian mentioned, these guidelines are for January 24, 2023. They may change next year, so we have to keep up with the guidelines.
Absolutely.
Yeah. Okay, all right. I think that's all the questions we have. We have another couple of questions that how can I make an appointment with Dr. Youssefian? I think he did provide his address and email. Very nice presentation by Dr. Youssefian. Fantastic questions. You can always reach out to him via email for any more questions. He'll be happy to answer that. And we'll end our Facebook Live session here. Thank you very much.
Thank you, everybody. Take care.